Good evening, everyone. Welcome to the Mind Center Advanced Medical Innovation Seminar for the 4th of April. So today we have a special guest from Singapore. So this is Mr. Yi Bin, who is Yi Bin, who is the Group Executive Director for Access to Healthcare, which is a global consulting company with a team of more than 30 across 11 countries. The company helps develop medical technology around the world to execute market entry and help support with regulatory and other business development. Yi Bin has more than 20 years experience in the medical industry, and it's a great pleasure for him to be sharing his knowledge with us on the topic of creating MedTech for the healthcare market, from the clinicians' dreams to reality. So while Yi is getting ready, let me introduce our panel discussion as well. We have Dr. Liew, who is the who is one of our main innovators. He's from the Department of Surgery, Ramatipati Hospital. We have Dr. Thitiwat Sangthorn, who's the Assistant Dean for Research and Education. And we have Kun Pakawat Nilawokong, who's the CEO and co-founder of startup for IQ Innovation. And online we have Tumpon, who's the senior advisor for CP. So we'd like to welcome Mr. Yi Bin, and please give us a talk, and then we will have our discussion, and then we will welcome the audience to join in any discussion.
Thank you very much for the introduction. It's really a pleasure to see so many students here and joined by the panel, which we just met a few minutes ago. Right. Let me start by getting ready to share my screen. This is working. On.
Can you hear all right? Can you hear me? It's my phone.
Let me just advance the slide to see. It appears to be a bit small, and I try to read it. So today's session is very much created for some of the doctors and clinicians that are present here. And it's by Adolf Chapis and the Mind Center's request for us to share some of our experiences working with doctors and working with clinicians, not just in one country but several countries. So they may explain to you in some cases how challenging trying to launch a product is into the market, but at the same time it also shows you the pathway, right, in which it can be done. So there are some stories that I'd like to start with, right, to explain some things that have been happening in the world today. So some time ago we met this surgeon from Poland about 18 months ago, and they have a device that helps to drug some of the wounds in the body. So using negative pressure is very common in wound treatment, right, and infection control. But generally, these wounds are surface wounds, and very few would actually do puncture wounds. So what he was going after was puncture wounds, stabs, gunshots, and all that. So the interesting thing about this doctor was that he got his own patent. That's why I feel okay to share his stuff here, because it's not going to be copied. However, that's all the money he has, right? He applies for his patent, right? And that's all the money he has, and he starts with this one prototype or two prototypes. And after that, he's like, starting what am I to do now? Fortunately, he met us, from him, right? And he started to explain what are the steps for him to try to commercialize his product. So he doesn't have money to turn patents to products. He doesn't have enough expertise to turn the product into something that is sellable and manufactured in a way that is scale. And there's no way to find a place where you could make a small batch of the product for some form of user testing. And beyond that, there are also other problems in the sense that he's a doctor, he's a thoracic surgeon, and he has no intention of getting out of clinical service and start to run this company. Right? And even if he does, maybe it'll be for like 6 months, and after that, he'll go back to do surgery again. Because that's what he has to do. And he hasn't had an opportunity to find anyone to either joint venture with him or run the business for him and all that. And certainly doesn't know anything about medical device regulations, and last thing of all, he doesn't want to be a salesman. So there's many things that he doesn't want to do. He has this idea, there's this patent that he's just looking around. So towards the end of this session, we will learn about what this doctor has done. So the second story I will share is about two ophthalmologists. So they are from two different countries, and they are prominent ophthalmologists in the government hospital system. Right. So it's important to note this story is in the government hospital system. It means they are working as an ophthalmologist in a government hospital. So they had some form of research budget, and I could estimate that they probably spend around $2 million to conceptualize 5 different devices. So this one doctor, right, managed to have one of the devices made into the second iteration. That is, they make one concept and they have another one. After that, it stopped. No problem. He really wants to spin out, but he's unable to control the company because the hospital environment says that he cannot be an executive director, he has to be a non-executive director, meaning that he can own shares in the company, but he cannot run it. And he has been very unsuccessful in finding human resources that are competent to support him in the prototyping and the research. The other ophthalmologists in a different country somehow managed to spin off the company, is able to market and run the company until sufficient revenue, real money comes up, right? And funds the company to hire. Now they have a CEO, they have a business development, they have operations. So yes, 3 of the devices commercialized and sold in a few countries. Created this software platform. Actually, he created this software platform where you have, is actually an open source platform where other clinicians come in and use it. And although he tries to further this device into different markets, he has challenges to determine where to set up because of several factors, including pricing, including suitability. So later on we will learn what these two ophthalmologists. So very different outcome for even the same start point. The third story is about this medical center. Right? So they have an innovation department, and they are expert in getting grants. They're very good at finding money within the hospital or outside the hospital. So they have a very large pipeline of devices, including software and hardware. And they started off with one high-risk device that involves some robot implantation, right? And rather is an medium-risk device. So what has happened is that we've been trying to license this technology out, and it was not successful. So why is that? It's because they didn't have any clinical studies. Right? And the animal studies are actually partially useful. And because they've done so much money, or rather they've done whatever money they have raised, at least all the funding has actually gone into the research personnel. Because doctors cannot run all this, and so they need research personnel to run this. So they didn't feel the research personnel, and this thing, there's not enough money left for trial development. But they can't test, we can further improve the device, but as a result, they want to stop. And when we try to license this off to someone, nobody trusts them because there's no place to go in. Right, so later on, we find out what happens to this business. So what's so different about healthcare? So just now prior to us being in this panel, so we were discussing it. Later I'll explain to you the key thing that's really different. If you have some points you can very easily remember. Right? Patient safety is the backbone of healthcare. There are no room for errors. Because who knows, right? One fine day, maybe the patient is someone from your family. Maybe you have created some medical device. Would you forgive yourself for creating something that is less than perfect? The other area to consider is risk. Right? So actually there is no perfect device, there is no device that is free from all errors or free from any risk. So therefore there is a need to have risk management. Right? In terms of how the product is developed, in terms of the business elements as well. So the third factor is of patients. Patients are unable to make normal consumer choices. If you have a heart attack and you need to say, does this patient ever ask for what stent are you using? No time. This is how it's unconscious, right? So they are unable to be like the rest of us when we can decide, okay, why buy this kind of shoes or that kind of shoes? Right? So they're compromised. And we cannot shop around in this life-threatening situation. For example, you must understand that there are some countries that are Muslim. Ramadan is something yesterday. So they had this ongoing discussion about making certain devices that are either put in the body or in the body as a halal device. Outside guys, if you have a heart attack and you need to have a heart valve put in, do you care whether this is for the big or for the heart? This guy cannot even respond, right? Okay. Regulations. Everybody knows that all new laws to go through some regulations. Same as us. We don't say biotech. Oh, God. My friends are. So I just and last thing here is about quality certification. Some of you may know it, right? And there is no, again, right, as we talk about patient safety, there's no room for error. If you distill down into 4 easy points, there's quality systems, regulatory approval processes, risk management, and a lot of more. Right? This is a part that is really different from a lot of different issues. In a business sense, right, if you run a business, what do you need to consider that is different in healthcare as compared to the rest? Time, right? Time in fundraising. So you don't raise funds so easily. Right? One of those patients takes longer. Clinical trials may take from months to years. Process validation, meaning that you have to confirm that the manufacturing of the work that can actually consistently produce a product in knowledge. That takes time too. Financial investment, money, right? Additional human resource, people for clinical, people for leadership. Standards testing costs money, so for people to know about the actual devices, so medical device has standard called IEC 661, and that testing is expensive. Biocompatibility testing is expensive. Right? So all these costs money. Clinical trials cost money. And this is why we have this program. A lot of the hospital because the hospital is actually partner clinical research center. And it costs money. Engineering. Why there is difference in engineering? Because there are different standards to comply to, not just make it available. Right? Earlier we talked about risk management. Next thing, which is something not so well understood, is about usability. So for most of you, maybe if you understand UI UX, user interface user experience, this is the same thing in medical device. What we are trying to do here is not about how easy it is used, but how we can prevent errors. But some clinicians use certain things in a way that nobody can expect. So we need to catch them, right? So then after that, find a way to modify the device so that it doesn't cause the clinician to use it. That's basically usability, right? And a lot of times, like the commercial side of things, there's a very complex and lengthy sales conversion. It takes a long time to get your first business, right? Because you're very solid doctors. You're very solid doctors. So this is good. A solid doctors are good. You don't want doctors to try a new thing every time, right? You'll be scared to death. Right? So some of the things. So one of the biggest mistakes that a lot of people think that they think they know is you know all this thing about infection management, you have it in this class, in that class. And just now we just saw that we just add a bit of quality compliance and add a bit of regulatory, you get good. No, it's not. Because the market segment is different, because the marketing is a very different group. The very strange behavior from doctors. They're dealing with sick people. Some of them could be friends, some could be family, suddenly it's completely different. The fulfillment cycle is different, and there's always this thing about being a person. It doesn't really happen in Thailand, but it happens in other countries. So let's go through this briefly. Okay, the market segment is the process of dividing the broad consumer business market globally consisting of existing and potential customers. Also a group that wants. So certain patients with this particular disease, women between age of 25 to 45, home business. So it's quite specific. Like our company, we only target medical device companies under $1 billion in revenue. So if we cross 1 billion, we are not in the group. Which is our policy. But then, because of that, we target a specific group, and because of that, our customers like us, because we know that we are for them. So when we make something, we must make them feel that it's good for them. Right, because we don't know. So a lot of times we won't talk about us public medicine. So step one about it is that it aims towards overfishing. A lot of this is very conservative defining things. As I said, it's actually a very good behavior. Let's say there are many situations where people have some ideas or some technology and they're trying to solve a problem that does not need to be solved. And the product, making the product cheaper is not solving the problem. But someone else can be cheaper than you. So even if they try, they may not buy. So some doctors are keen to try. Maybe it's part of the multiple functional, maybe it's just doctor himself. And they may not buy. They cannot buy because they will be making also the people as well. Okay, if they buy, are they enough? If this software already enough for you to make money? If it's less enough, for you to do good, okay? But it is not enough for anything to happen to someone. Because if you're not able to solve enough, that means the process is not over. Six people, right? So in the first one, the total which is really 6 people that is relationship people that are compromised. It could be your friends and family. So I have many classmates that are doctors. As fate would have changed a lot my training things are wrong. And I can surely identify with this because a lot of doctors are able to treat or operate on the friends and relatives of the family, so people are really allowed. And this sometimes is very difficult. So product commercialization is very hard. There are many steps to it. Just to explain, you can take pictures of this. So why this picture is important is it explains the steps in which we have to go through in order to get the product to the market. So you can see many texts in blue, right? It just happens to be the services our company offer. I'm sure don't worry about that. In general, like you have to get funding, you need to prototype. Then when you spin out, the first thing you do is set up a quality management system. You do design, development, and all the chemicals, and the release to manufacturing. Then you think about how to market this, getting the approvals, finding the channels, and finding the products. For a go-to-market strategy, that means how you will advertise your approach to the market. So there are many people that didn't know that actually there's more than one factor, which is not just market segment. It involves the market segment, of course, which we talked about, intellectual property, which is about patent application, reimbursement, it means how the product is to be paid. Is it paid by the government? Is it paid by the user? Is it paid by insurance? So we need to figure out the different countries, they're all different. Certain clinical activities could be different in different countries. Some may require patients that are resident in the country, like in the US. And finally, the regulatory pathway. How we follow this? We follow directly, we go through the US regulations, we follow this. What are the different ways we can do this? So all these factors they work together. Right, this is the part that is very challenging. It's very difficult to find companies or people that know all these things, right, and understand how they work together. So they fail because there's lack of this independent considerations, all these factors concerned, right? So the go-to-market strategy follows the same methodology as the path of least resistance. Resistance is defined as a summation of time, of cost, and organization effort. Right. For example, time, right? Intellectual property, right? You need to file patent, and usually now you could try and file a PCT. Although I was recently just told that it's not so easy. Yeah, maybe we can find a way out. Right? And that takes time, right? Regulatory pathway, the clearances all take time. Clinical activity, that all takes time. Right? Cost-wise, right, it's pretty much the same. Right? Clinical activities cost a lot of money. Right? Reimbursement affects the pricing of the product, and the market segment is determining how large your revenue could be. So any changes to the clinical workflow may change many things. Some examples. Right? So if we change the internet workflow, it means instead of having 3 nurses touch this, we have 2, or is one part of it sent out or the hospital and back, then maybe your intended use may change. Right? The intended use is defined as what you want this device to do. And because this intended use is changed, maybe in some countries the device classification, which we learn later, is also changed. And as a result, right, the regulatory pathway is changed. If we change the intended use, maybe it leads to the change in the market segment. So instead of using for everyone, we say we're going to use for only for kids under 5 years old. Then your market segment changes. Then because of that, the reimbursement will change. We change the technology, right? So maybe this, instead of doing this way of doing it, you use the other way of doing it. And your IP is not different. Right? You found out the change they are making will be different. And because of that, right, then your market segment will change, your device classification will change, then your strategy will get. So all these things, they are all interconnected. There are very few people in the world that know. Okay, the realities of the market segment, just like any sector, the market is saturated with various players, right? Various solutions, various technologies, everyone wants to do the same thing. Okay, look at the past 2 years, right? Everybody experienced, right? I don't know how many COVID test kits, but they use all sorts of technology, but they all claim to be like fantastic. Right? How do you know whether they work? Let's even with Europe, they all use different technology, right? Then it really depends on your ability to connect to the clinical ecosystem. Okay, let's say you use COVID testing as an example. So they will find a way to the Department of Medical Science, and after that, they will take like months before the first test kits are approved, and then they have to find a way to get into the public health system. Or do you want to sell to the private sector? Then you have to decide. They have to decide. So how would you position your product? Is this for the high-end market, low-end market? Is it for public or is it for private? So every decision you make, right, is a different pathway altogether. The other thing is about the customers. This is one of the things I find very, very unusual. Many companies never even met their actual customer. Really spread by them. How can you sell something to somebody if you know about the customer? Right. Okay, for example, let's say you do a device for wound care. Maybe you have this bandage that has some medicinal properties and you would like to see maybe generate some acceleration in healing. You have never seen an actual wound, right? How would you market the product? You can't. You may think you can, but actually you can't. So our advice is as far as possible to really see your end user, right? Whether that's a tradition or that's a tradition. Then you have a feel of whether the market is large enough to sustain the business. Right? Let me explain a totally different example, totally different from revenue loss. It's about retirement homes, right? And they were making some inquiries like whether they can set up a high-end retirement home for people. Then I was rolling my eyes and said, okay, where are you going to get the business from? Oh, we can maybe get it from the rich Thai people. I was like, do you really know Thailand? Any rich Thai people will just buy a piece of land, put their own retirement in their home. They don't need you. I was like, who's that? So they come from overseas. Have you talked to anybody from overseas who want to retire in Thailand? They are, right? So how do they retire? They have family in Thailand. Good. So why do they come to your retirement village? So special. Then next thing you know that these are usually like single people who not get married. They doesn't want to marry local, and it's just like a rich person's club. Right? They don't need any fancy medical device. They don't need any fancy treatment. They don't want to be next to the hospital because they're not sick. Right? If they're sick, they are going to the hospital. So these people have no idea because they never met the customer, and they never knew how large the market could be. So before you even jump into doing anything, you really have to find where the need is. If there's no need, then there's no need for you to do that. Then lastly is, okay, now you know, maybe you would have some customers. Next question, how do you reach them? Are they here in Thailand? Are they out of Thailand? If they're out of Thailand, then how do you reach them? Okay, various ways. Market segmentation could be very diverse, right? Could be diagnostic imaging, could be surgical, could be visual diagnostics, could be drug delivery systems. And answer these two questions. which market should my product go to? How do you make these products successful in the market? You have to answer these two questions in this order. Then that means that, okay, this product is meant for this country. What a particular country has a very different dynamic from another country. So if you jump into how to do it first, because maybe you studied this in school or some marketing manager has drawn, and suddenly this is the way that this person knows how to do it, but it may not suit the market that you're trying to go, and all the effort could be wasted. So you always have to go after firstly the country because of some factors. Once you have confirmed it, then you put in effort to say, okay, this is how the market is. I remember 5 doctors that I come to the country to work for me. Can I use social media? Should I use the dealer? Then these decisions can be made. Then you get all these market research papers out there, right? This means nothing. Because all these data come from like 5 years ago. No use. Okay? And they'll say, oh, the figure will grow 15%. Every single graph you see always going up, right? Have you ever seen a graph going up? No, right? So it's like, why? So no point. So the real information comes with connecting with your end customer. Right? So this is one of the areas in which in Thailand this is a challenge because not many people in Thailand will think about connecting with patients, and the first thing they think about is to no, right? You can connect with patients and learn everything. So in some countries, like the healthcare providers are paid by the reimbursement systems for the devices, like the US, Japan, in Korea. Here, to some extent, there is some coverage that is quite different. Right? We could have private insurance, right, and all that. So the payers are typically private insurance companies or government agencies, right, which is covered under the scheme. So manufacturers need to determine how their product will be paid as part of the product marketing strategy. So, okay, why does private insurance matter? Okay, then you must think from the angle of the private insurer. The private insurer is to take insurance premium for all of you, right? Everyone pays a premium. Why? Because they say that, okay, you pay this premium, we cover you for this, for accident, for hospitalization, for this, for that. And why these devices will matter is because maybe if I deploy some type 2 diabetes early detection system for you, then maybe I pay a bit more, but at least as an insurance company, I don't have to pay out more. Because later on, if you suddenly develop type 2 diabetes, then maybe I have to cover it. So some things like that. So sometimes insurance companies know that, oh, if I put this out or if I do early detection, then I have a chance of winning the premium. Right? Okay. So then suddenly we know that, okay, this device will help them make money, then maybe they can help me market because insurance companies have a very large customer base. Right? So this is why sometimes the private insurance companies are useful. So I drew this graph a long time ago. Till today, it's still valid. Right? So on the x-axis is RP and WP. Right? On the y-axis is private healthcare and public healthcare. So Thailand is here. Maybe just next to the, because there's a lot of private hospitals here. Right? Medical tourism is huge in Thailand. Right? At the same time, there's not so much subsidy that the government provide. So we do provide some, but most of it, well, obviously most of it, a significant portion of the market costs is paid by the users. But that's of course the role for the government to have scheme. Okay. So we're going to jump to another topic, right? These are standards. And documents used as rules, as guidelines, or definitions of characteristics to ensure materials, products, processes, services are fit for their purpose. So I divided this into different types of standards. Management standards, which is used to manage the organization. Design standards, which is like a process to design something. Performance standard, which if you design something to this way and test it in this way, you will meet the requirement. And product specific standards is really meant for a specific product which has certain design features. So I group standards in this section. So the other thing to know is when to use what standard. Actually, there was another chart about which part of the commercialization process you will use what standard. I think this is more useful. So management standards will be like ISO 13485, 14971, risk management. These are called management standards because they affect the company. Right? Process standards, right, would be things that you use to manage the process like development cycles, like software development, IC or system development, usability studies, like 6 to 2. These are all processes, 14155 for technical evaluation, all processes. So this will determine the environment in which the device is likely to be used. Then you have design standards. Right? Here we put examples like 10993 for biocompatibility, 926 will be the one for electrical safety. Right? And there are hundreds and hundreds of product specific standards which you can use. And there are also complementary standards which are not specific to medical devices, like 27001, which is for information management systems, which is for data security, and 31,000 is for business risk, and 14,000 is for environment. Right. So all these standards, right, are all part of the creation of the enterprise. So quality management system, right, will be ISO 13485, right? I think a lot of you will at least know what this. I have the honor of really the unfortunate task of being part of the drafting committee for this. So if I cause anybody any grief, I'm sorry. So there are 8 main clauses, and if somebody wants to compare them with the US FDA, it's very, very similar. So they talk about documentation, they talk about how to do developments, they talk about how the organization is being arranged, how much power does a quality management quality manager have, like what do you do when it's been changed, what kind of methods do you follow to do better investigation and to have corrective action. So there are various things that discuss. This is what it means by a management system, like a management type of standard. Now, in terms of the product development process, we have there are many people that have different ways of doing so. The minimum number of phases are 3: design input, design output, design transfer. Right? So we just do it in 5. So any number is okay. Some do it in 10, some do it in 8, some do it in 6. So there's no right or wrong. What is always the same, right, is that we need to do market research, then to do planning for the development of the device, and to start implementing the quality system. Then we will start to consider customer requirements and risk management of things, and the development of the proof of concept. After you've done several iterations, then you do verification and validation, right? And to ensure that all of your customer requirements are accurately translated to engineering requirements, identification goals. Then 4 will be for marketing, for scale-up, for manufacturing, and 5 will be for different approvals. Right? This is very difficult, right? And it can be more details or less details, but generally this is how it is. Risk management is a very special thing in medical device, because a lot of industries don't really have this included in the product development and after the product is sold. So you first analyze risk by looking at the intended use. Actually, it goes beyond the academics. It goes into the clinical workflow. Step one, step two, admission to step two, step three, step four. Then you start to analyze every step what is wrong with it. When you design a product, right, every part when it's there should have mistakes. When you make the product, every process step when you put have a mistake. So then you start to ask yourself, what caused the mistake? Is there any way I can control the mistake? Right? And if I control it, okay, how well can I keep it controlled? This is the most this is one slide to talk about medical device utilization. The intended users to be able to use the device without having any use errors that can compromise safety. So that means that the most common example is to use a stopper to try and open a can of food. So you don't do that, right? You don't use something off the floor. Actually, many doctors use many devices off the floor because they know it works. But that's the point. If it actually works, right, then the manufacturer needs to learn, okay, actually this device uses this other way actually works. Can we actually include this in our intended use? Maybe we could. But then if nobody knows all this, then how do we do it? So in any case, as a responsible manufacturer, we would want to know whether we can spot as many what we call foreseeable misuse. It means something that we can foresee, and we can predict, and it's being misused in the particular way. So if we can foresee this, then we can do something to correct it first. Alright. Then it must be done in a particular use environment. So you can't have a device that's done, let's say, in this room, when it's supposed to be done in a ward setting or in the operating theater kind of setting. So you have to, if you don't have the facility, then you have to probably recreate the facility. And that's why I hope one fine day, I want to do the hospital with a using that, which I hope that we will work together on. Then from that, we will probably set up some video cameras to record what the nurses, the doctors, or the patients have to make. And after which they can start thinking about whether you included the right user interface. This also includes any electrical device where they have rapid user interface. How quickly can they go from one menu to the other? How quickly can they actually operate the software? All that is part of this user interface, which is what some of you could have done as PhD. Okay, then next thing to just get an understanding of this. In this world, right, there's all these regulations. And to put it down in very, very simple terms, this is what we need to do. First of all, right, we look at the device. Are you making it or are you importing it? Making it, importing it, right, will have a significant difference. Right? Because making it has much more steps, much more documents. Then you are selling alcohol. Importing, right, means that you are bringing from outside into, let's say, Thailand. So then you have a different set of considerations. Okay, next thing is the device definition. Is this a medical device? It sounds stupid, right? It is, of course, a medical device. But no, medical device has a specific definition. If it falls within the definition, yes, it's a device. What if it falls outside of it? If it falls outside of it, then it's not a device, then you can go through a different pathway. Okay, let's say it's the device. Then we start to ask ourselves, what is the risk? So after you understand the intended use, you know that it's a device, then from that you will be able to find out what class is. So the Thailand in class 1, 2, 3, 4, which just changed, right? Okay, so let's say you know the classification. Then you start to think about the pathway. Okay, how do I get this through to the client again? Okay, let's say class 2, GSDP, certificates, fill out form, input into online system. Okay, so that's all. Right, then you will know what's the fee to be paid, how long that fee is going to take, and what kind of questions that we will ask. Right? All regulatory frameworks are the same. All. Device classification, right, is also very straightforward. Okay. In the past, right, in Thailand, we used to have lists, right, what we call licensed device, notified device, and everything else. The problem is, some of the licensed device could be a glove, could be a condom, could be a contact lens. And next thing you know, right, in photon ablation device which removes, let's say, some cyst or some tumor, right? It's a general device. Takes only 2 weeks to approve and all that. So, I mean, Thailand has gone through all that, and now it at least have a proper 4-class system, right, which is matching the device with. So there's a few steps moving forward to next week. So there are different classification for medical devices. There's ABCD, there's 1, 2, 2B, and there's 3. So they could be 2 class, they could be 3 class, they could be 4 class. So in general, right, they still follow the same kind of methodology where it is from low risk to high risk. Some countries have different classification systems for implanted devices. So active medical device for implantation usually refers to pacemaker. As you know, right, in the pacemaker fits work at large scale, right? So that's the reason why we track differently. So some countries have a different way of classifying control diagnostics, like in Australia, it's different. So there are many complications to this too, right? So there are many different definitions of device. Because of the difference of device, so therefore the classification methods will be all different. So the software is not aligned across all countries. Some countries consider veterinary products as a medical device. Like some days ago, I was actually at a pet clinic and I saw this distribution hub. And just like the work hazard, where's the cinema? Where's the real one? Who quoted this? Then my friend was looking at me crazy. He's like, what are you doing? I said, oh, just checking whether this was brought in information. Yeah, because it's yeah. So in any case, there are also different class of products, right, which are classified as a device. Toothbrushes. Toothbrushes are actually a device in America, but in many countries not. Then why in the world would a toothbrush be a good device? Because as you brush your teeth, right, you are reducing the opportunities for dental caries. So there's actually a medical purpose to brushing the teeth, and you can prove it. But so then there's another thing to talk about in regulation, which is the reference and the so-called the Big Five. Now, why we have this Big Five is because these were the first few countries who kind of developed regulatory framework. So next thing you know, right, they also represent a significant share of the medical device market. So between the US and Japan, right, it's really close to half of the device partition. So as a result, right, they have a lot of weight and a lot of influence. So this is why all other countries, including Thailand, will respect this kind of framework. They say that if you get approval, yeah, then definitely Thailand will go faster. So in the past, right, a lot of Thai companies cannot even launch the products first in Thailand because there's no regulatory system. And now this is a lot more easier because now they have one. So many startups now can actually launch products directly in Thailand. In the past, they would ask, the FDA will ask the company to go get a CE mark first, but after they come back and register. Ship already. So this topic about quality and regulation, right, is many considerations. Right? So there could be strategy considerations, product development considerations, risk management, clinical submissions, and product launch. And the other thing that I could highlight is about post-market surveillance, which is after the product is launched, you may have complaints. And this is one thing that I would stress. When the product has no complaints, you should be really worried. It's just like if you go out with someone and the someone doesn't give feedback on whether he or she likes it or not, you're not scratching your head. He or she might be yes or no. Right? So it's the same philosophy. If you don't get complaints, right, that means most likely the distributors are not working. That means they have complaints, but they're not getting back to them actually. So this is the area you use them. Now jumping away from all this very dry stuff, right? Okay, so around the world there are different types of innovation centers. So I can share some of them. So like in Singapore where I come from, there are several innovation centers which drives the development of the university. And I see actually sometimes. So National Health Innovation Center, they are actually a funding agency. But this funding agency is real special because they also buy entities by us, by to support the groups that they are funding. So the unique thing about NHIC is that you must have a government tradition is to partner for them. Then they can fund the tradition is not part of it. So there are also other innovation centers, like for example in NHS, there's this center for innovation healthcare. So they are very fond of getting all the doctors to come create stuff, and then they will try to connect with innovation partners to launch. So in Thailand, there's a bit of this, right? And we got to know some of them inside the White Center. Like in Sri Lanka, there's UTC, development for them. Right, and this will be medical innovation district. I think last week we had a discussion with them, they were like fascinated about what we done. So treatment training, I think some of you may know, right, very popular in developing devices. And this other one which we like very much is called knowledge share. It's actually based in Italy. And if you go search their website, they have a lot of research projects that the website is actually done quite nicely. And it's not done by some external party, it's actually done by one of the staff of the information organization. So with all these innovation centers, so a lot of ways to provide funding. Right? So share some funding scheme examples with you. Right? Some of you may find that some of these are actually very similar. So NHIC, as I mentioned earlier, provides funding. So they provide funding in three different streams. Right? Innovation tech, like tech is actually the technology. Innovation to develop, which is to develop the product to a certain PRM stage. And innovation to industry, which is to hook on the industry partners so that they can take it. So their funds is about maybe 200,000 US. And actually, you will realize later that it's a problem. So you just remember that. So within the hospital, they also have smaller sums, maybe 50,000 US. So what they do is for pilot project studies, early proof of concept. So they have all these funding drives, maybe once every 3 months, to give up 50,000, 100,000 for research team to do something. Right? So it's something like seed funding. So this can be combined with the earlier funding from NHIC to a bigger fund to do something. There's actually other funds, like for example, what we call the NRF, the National Research Fund, that comes up to several billion US dollars. But that's for drug delivery for pharmaceuticals. And in one particular case, which we will not go into detail, it actually created a very special platform. Something is really wrong, right? We find that a lot of times the fund size is too small. For healthcare, for healthcare, right? I'm not talking about any other issue, we're talking about healthcare. The fund size is too small. Right? Most of the funding, right, and because it's so small, right, and you need people to run it, right, at the end of the day, you are spending it on salary. Right? When you spend it on salary, then you have no more left to be spent on the development. So sometimes you may have to engage other companies to do something for you. You have to buy materials, you have to buy machines. Next thing you know, I buy 2 people. Time, right, for 1 year. Then after 1 year, you will start it. Find another research plan, and the next thing you go, the management asks, okay, what have you done in 1 year? One prototype, and that's it. Why? Because you couldn't, you don't have any more money to develop the product for them. And you need these two research assistants to run it. So something is wrong somewhere. Right? And we have also seen a case where this close survey of what we call the opinion of one. So you ask one doctor, or one doctor asks one other doctor, and that's it, then they represent the rest of the world. Not necessarily true. So actually, a lot of times, right, we never had the opportunity to go out and ask for more. It's our whole place like we're all graduated, we have the opportunity to go out and ask for it. Right? There's also this issue of the restriction of clinical partners, which means that the environment says that you have to work with these guys, or you have to work with those guys, or you cannot work with external companies, or you cannot work overseas for this. There are a lot of restrictions because they are all using government funding. So it's not wrong, right? It's not wrong, but it's not helping the project at all. So some of these problems have no solutions at the moment. And I'm not talking just about parent, I'm talking about in general, many people same problem. Now we jump into another area in regards to medical device, which is the operating competition. So earlier we talked about a lot of things with regards to design development, manufacturing, all that. So there's this part where you can actually import products, or you can import products into other countries. So there's the flow process, which is always the same. You just only require to ensure that you have the license. You have to be sure that you have gathered all the licenses. Why? Let's take an X-ray. Right? When you bring an X-ray into Thailand, for example, other than submitting to the FDA, there's also the radiation agency to worry about. If your X-ray has virus components, then you need to go talk to the telecommunications agency office. Right? Maybe it doesn't take a lot of time, maybe it does, but then therefore you still have to consider it, right? Before you can bring it to the question. So again, I always like there's again something wrong. After spinning out and all that, right, there's no commercial need that's available to run a company. So I may have the doctor, I may have the engineer, I may have someone that does the research. But next thing you know, I spin out and then nobody does business for me. The other problem we see very often is the lack of customer empathy. That means you don't understand what the customer really wants. Because you need to push this technology or push this product out. As a result, you forget that actually you have the customer to satisfy. Another common thing we've seen is that some doctors or some engineers have no idea how to develop this to actually get the product out to the market. And some of them are obsessed by just finding distributors. Oh, some distributor can do this for me. Yeah, sure, if the device is so new, but do you think they know how to do this? You have to teach them, but I thought they're supposed to be the expert. No, you are the expert. So now we round back to what's happened to those 3 doctors in Portugal. So this Polish doctor finally managed to connect to some venture capital, right? So now they're starting to think about how to do the industrial design, prototyping, and produce a small batch for the clinical trial. And they're resourcing for a factory for industrial production. So just a pity that because there was the Russian people more problem. And this thoracic surgeon actually mentioned the border, the Polish border. He saw many things that well, that's a question. So I asked him for. I did say in the device actually could be launched a year earlier. It would be very useful in the second. So the two autonomous is right. Okay, so the one that wasn't really successful now has managed to get some government funding and they're starting to see whether we can further some of the programs. So the first iteration worked, but the second one is still in discussion. And basically, instead of 5 devices, now they are focusing on 2. So they focus the resource on just 2 that they feel that is will be successful. The other guy, right, is happy, right, he's already launched into 3 markets, so they're looking for more. So what about the medical center? So they found the medical device company, right, it does dental, right, to do some form of research evaluation. However, they did something they shouldn't do, which is they took the ideas that was being given to them and were trying to help them license the technology only, right, and they tried to use it using the current application. And they actually dropped a lot of projects except for all the mobile devices because they couldn't get enough funding. There are actually many stories that you can share on this, which was on time. And there was one with regards to this hardware, which I mentioned earlier. Lucky, instead of spending 5 million, they spent 2 million, they got the product to work. And most likely going to be successful. There was another case where it involved this drug delivery scans, and it started because this distributor was frustrated with the poor quality from China and India. So they decided to take matters to their own hands and work with the doctor to come up with it. The last one is a liver cancer diagnostic software. This doctor is really ashamed because he managed to get a solution and he wants to further the development. And the government forced him to work with the government research institutes, which didn't understand medical at all. And they wasted 3 years, right? We have 250 images. His junior consultants had all done the demonstration. And it was given to this research organization, and after 3 years, they said sorry, we can't do it. And the reason why was because he was stubborn, he didn't listen to the doctors. We cannot do it this way. We cannot do pixel analysis when we are looking at images. Oh, okay. That's all. But success can happen as well if it's led by some research or some clinicians. But this company from Japan was established a few years ago. So the CEO and founder is an old guy, and he's a surgeon, and he's a teaching surgeon. But look at the amounts of capital they have raised. Okay, fine, it's in Japanese yen, but if you start doing conversion, it's still quite a lot of money. For that matter, they have more than 60 staff as a startup. It's amazing. And then they have a US office and they want to get into a simple market and have a research collaboration with the government hospital. Yeah, fine. There's another company that does screening for breast cancer. So it's actually hardware, it's not software. So they established in 2016 and it's spin off from the CHP. So this CEO is in the right? So that said, right, his wife is a doctor. And again, right, they have a lot of money invested together. Now, this is very interesting because in Japan, there are many medical device manufacturers. So because there's so many medical device manufacturers, there's almost no need to create medical device startups. And so a lot of the corporate fund, a lot of the government funds all went into pharmaceuticals. So how did they manage to get money? It's because, right, at some point in time, the University of Tokyo, because both of them actually came out of the same hospital. And again, it's a teaching hospital, right? Just like our own. Somehow the adjuncts will manage to convince the management to allow them to spin off. They had some corporate investment, a lot of that came from the company. So in that sense, right, they actually funded very few medical device startups, but all of them are very profitable. So they are very likely to succeed if and only if the people in the startup will make greedy. Right? Like sometimes we have this board of directors in the startup. So fortunately, they're both still alive, and it still remains to be seen whether they will be able to be successful in this. So saying all that, right, okay, what the heck does the company do? So here are some example company. So we help all these small to medium-sized companies execute a lot of those activities that leads to the product we launched. So there's a 30% of our business, right, is actually the information management. But 60% of business is dealing with day-to-day issues with this medical device, small to medium-sized companies, which are dying to expand. So we are founded in 2015. We are self-funded, that means no investors, no corporate investors. For goodness, there's not even any government grants. And this part is really silly because I came directly from corporate land, and I didn't even know that something called a grant even existed. So I forgot to apply. Somehow we survived. Right? So we have 11 country offices, and they all belong to us. So we literally own every office around these countries, including the entire office. So we have about 32 people, and we only deal with medical device. We don't deal with pharmaceuticals, we don't deal with biotech, no food, no consumer, only medical. And we do everything that is needed in the device supply chain, including industry. So with that, thanks everyone for your attention. I really appreciate that we managed to stay awake, right, to listen to this week all this in English, what we really did it. So I left my contact email. You can see there's a QR code there, you can scan it, if you press that line. With that, thank you very much.
Some water. So thank you very much, Liew. That was a very interesting and very broad and comprehensive walk through medical device development from a perspective of trying to get things to market, which is obviously something that I think many of us here in Thailand are trying to achieve, but I think few of us actually managed to do that. And I think it's a great pleasure here that we are able to come from Singapore to see us, and that we are able to have the students here who have come a long way as well, trekking across town to join in the meeting today, as well as other staff. So, and I think we would welcome questions from them in a moment as well. But I think we also have commentators from our staff who have, I think, all been involved in the industry in some ways. And so I think we would welcome some questions from Ajahn Liew, who's a very active in developing many medical devices and probably has had a lot of problems with a lot of things that you have described, and we can share some of those or ask some questions. And we have Dr. Titiwat, who is, I think, worked in industry in Germany before, so we'll share, I don't know whether he's done any here, but before we share any perspective. And Kun Mapawat, who's currently probably struggling through all this with his own medical device and startup. And we have one who also was online who is from the other side, who's from the corporate side, and with strong interest in medical device development. So Maybe Dr. Said, I think he's looking to start.
Thank you, sir. Anyway, I would like to thank the channel to have me here, the great opportunity, and also I'm grateful for you guys for letting me here. In your kind interest in this panel discussion. By the way, for your perspective, for the medical student, I would like to share about the innovation, like an innovative DNA that I have ever mentioned about from Jedediah from our university, talking about the five characteristics of the innovation of the observation, questioning, experiment, and the two grade of the characteristics of the association and networking, which would be, I hope that you in two curriculum would be joined together and will be informed from one day. Anyway, for the informative, the formative presentation from ED, it's talking about the trap that, the big mistake, if you share again, it's talking about the trap that our innovator like us always trap into, we have to think about, pretending it's a need, not your need, but it would be customer or the patient need is very important. The second is the market. You have to know the market, because if you just, feel fun or happy with your work, but you don't know about the market, it's a trap. The last one, you have to have a great teamwork. You can see the person sitting beside you would be great teamwork and what you do. Because you cannot be only one to win this game. You have to be a team. And this team, not only doctor, you have to have a volunteer, a finance, and the management together. You can really be safe and make the dream come true. To answer the topic that we discussed today. For the last thing, actually I have one question from my colleague in the surgery department. They cooperate with the scientists from another university and they would like to make the same to the partner for partner. But this study is commonly used and have a government cooperation. Especially they still working on this field. Is it worth enough to work on this innovation to be an innovator? Is it worth enough? It's a conversation. Thank you for your answer. Thank you.
Thank you very much. This is, in fact, a very common situation. And somehow, because of the available resource and because of the available knowledge, they're doing something that everybody already has done. Then remember we talk about, they do this cheaper, someone else is cheaper than you, right? So the only way out from this, right, is to find whether this product is in shortage in some country that other manufacturers have not used. If that's the case, then we really have to go to places that we never do. Right? It could be the case. So, okay, one particular case, which is slightly different from that, is there's a big bulk replacement that is actually accessed from tomorrow. And this is a device that only few companies are doing, including one very prominent Chinese company. So these guys are split up. They came out themselves and they formed a small company, they got investment, and they tried to do this and sell it to Europe because they want to do the clubs. And the only value proposition was marketing this as well. And for that device is okay because the number of suppliers are limited. If you can do cheaper and still as good, okay. In this study case, there are a bit more options to select from. So the only way out is to find markets and not with caps. Then we have, then they have to also understand why are they not capped. Cost issues, they may not be able to gain, right? Is there corruption there? Who knows, right? So there must be a reason why certain people have not gone into this market. They may get lucky, they may get one program, they are not happy with this prices, they will give us something cheaper. Oh, maybe. But if they don't wish to spend this effort, because it takes effort to go out and find these markets which I don't know, if they're not willing, then it's gone. But if they're willing to put effort and some bit of money to do so, it's okay. One thing I have to caution against market research, do not use that. Go to the country yourself. Well, if you have clinician contacts, ask. Do not look for market research. It's not.
Actually, sadly, I have experience to work together with the industry. So I'm actually like others classical faculty. So always work in the university in academia science, and in my so actually I'm in the drug discovery industry, and for that, so I also have experience to talk with the people in the industry, in the discovery industries, and they say that they don't believe about the discovery in university because it never works. If you need to do that discovery, you need to spin off, you need to go out, and this is for the industry only. What people do in the the discovery in the university is useless. This is what I got feedback from real industry people who are in the discovery industry. So my question is, so in your opinion and from your experience, what is the role of university in the medical device industry chain? What we should do and what we should do?
Right. Thank you for the question. And you tell the guy, right, that's drug discovery, not necessarily in the university, but in any academic organization actually does work. It's just how which part of this drug discovery is in. So there are in various countries there are even research institute run drug discovery platforms. They do a section of the drug discovery, and after that they will be looking for people to just let them carry on, but never the initial. Never the initial. So maybe after one has gone some way, and these people were just founders that found these molecules just didn't have the resource. Then they go to this research institute where they have all the tools, all the points, right, to go to a certain level. Then after that, they carry on. In terms of medical device, I think the track right is different. There are many people that are writing research papers and all that, part of the PhD program or master's program or things like that. And I don't know whether there's some pressure to turn this into the technical product. And sometimes, in some cases, some will be needing for some of these projects to have some kind of a commercial justification that, oh, yeah, maybe we can spin this off or all that. So in other countries, they usually have a section in the grants application that says, okay, this product is made, it can be commercialized to these countries and be useful in this and that case. So but you cannot avoid this because they have this mandate to push the technology out. Again, it goes back to the customer need, right? So the early uh, phases, no, the early phases of research almost is to scout for unmet needs, right? Unmet needs. And when you scout for unmet needs, right, then it's combined together with primary research to see that, okay, can we somehow do applied research to bring this to a next level, maybe to start to think about product, right? So actually nothing is really programmed, but because you have to balance between what a university needs to maintain its ranking in certain areas versus the realities in the market today, right? So actually nothing is really totally programmed. It's just not perfect. It's just not perfect. I feel that the main problem is what I described earlier with regards to the amount of funding. We can't give equal funding right to different sectors. It is not perfect. This industry is very special because you will realize, let's put the money aside. You know why you're all in this school? You know why you're not here? Because our brain all are different from everybody outside. You know why? Because we care about the patient first. We care about the patient first. Money comes to that. Right? Because the fundamentals that the patient was either well or was alive. And because of that, right, okay, our mindset is different. And because of the fact that we have to have all these things that I just talked about, right, to make the device safe and effective, that's why it needs time, it needs money, and it needs effort. Right? So the funding agencies don't understand this. So we have to all find a way to work together to make the funding agencies understand this, to make them understand that anything in regards to drugs or the medical device or the biotech in some cases is not meant to make money in the short term. It's meant to be for the common good of everyone in the long term. And if you happen to make money, great. If there's a way to convince them in this way, then maybe the kind of funding that you're getting is higher. Then maybe we can a way of saying that, okay, we may only use funding for hiring human resource up to this percent, and this other percent needs to be used for the actual development. If we have the opportunity to change the way money is being dispersed, then maybe we can make a difference. It's a very difficult task for any country, not very tough.
Another question is, so, as capacity of the university or role of the resort, the university itself. So beyond the ability as an inventor of medical device, we have other roles or possible roles in the university for medical device, especially as a university hospital, beyond creating a new or we always face directly the problem and normally our role is to invent or create some medical device. We have other roles, we have other possibilities.
Right, definitely.
Yes.
Definitely, because there's you just said, right, you're out there to create new things. And many corporates are looking for people to create new things. The only condition is that the corporate must allow you time to create things. Okay, I worked in New Zealand before. Just you should really go there and just have a special scheme. That said, right, the company has 1,500 employees, and the engineering department has maybe 400 engineers, and out of which there are 70 engineers that are paid to do this. They're paid to do exactly that. Why? Because they need space to think of these things. Right? So why do they need space to think of these things? Because it's all been trapped into a certain environment. People doing day-to-day actions. You cannot think of anything. Again, one of my friends who is in design disagrees. So she says that sometimes we need to be stressed to design things. And as a designer, we need to work in a way where we are still stressed, but we can still design. Then I said, actually, yes, you're right. Because when we are stressed, right, what we start, our brain will start to think, okay, how much time do I have? What are the resources around me? This is design constraint. Right? Then what do I want? Am I trying to achieve? No time for all these science stuff. Okay, then what's my customer want? It's the same thing. So if you learn all these basic principles in the university, right, and if you have a startup that was successful or partially successful, and you decide to get out and go work somewhere else, a career advancement in a different way, right? These are some of the things that you can say to the company. I work under stress, but I can still design things. Right? I'm given space and I can do more things. Right? And I think many companies will value this. Right? Now thinking outside of the box is great. But no matter what, right, this out of the box thing, right, still has another box, which is all the regulations, all the paperwork and all that, which a lot of companies don't do. So if you learn it in school or learn it now, right, you say, okay, fine. I can do all the work, or they will love you to death. Because they don't have any. Right? So there's many things that you can do.
So I think one of the things that we're doing now is actually having you come to talk to here, and I think hopefully this will influence some of the students to say what they actually maybe put on by saying, well, how difficult it is. But I think for some, maybe that they start thinking about the process that is necessary. And I think Dr. Solly talked about the need for innovation and the steps that would lead to that. But I think what you're bringing to the table is also that there are beyond innovation and thinking ideas, there's actually a lot of practicalities and details. So I think you need to build that in right at the beginning, to think about, be aware of that in the real world, that if you want to be successful in that way. I think, so I just want to bring that back to Guns, who's actually going through the exact steps that you're describing as a startup. So can you share some ideas and maybe ask Dr. Liew some questions?
Thank you, Dr. Thank you, Evin. You present very great presentation. You know, I'm facing all the things that you just saying. Everything, you know, is waking me up all night and sometimes. Doing the startup is not like, you know, it's not a very straightforward process. Yeah, it's very difficult. It's very difficult. Yeah. And, you know, Dr. Saru just says, if you want to be the innovator, you must be, right? It's not only your knowledge, it's your brain as well. You need to fail a lot of, failure many times, many times. But if you want to be successful, you need to get up. I will bring my question to you. I have two questions. One for student, one is for me. First question for the student. If those students, they come up with a new idea, new technology, what should they do? They should go to you, go to Dr. Salu, stop studying, doing the business. It's same as big job, right? Yeah. Second question is for me. I'm doing the startup, and I told you, if one day it's not success, when should I stop?
First question is, well, I think there's something that is not very good at us. Okay, talk to you about the point of affairs. So he's working in a very stressful government job today. He hates his job. But there's one thing he likes, and that is to make this Chinese dish. It's made of yam cake. What? Yeah. I make yam cake and you know, yam cake you have to like buy many yams, manually cook it, and after that put seasoning it. Then you put it into this big tray, and here's a big tray and it's several layers, industrial size. You know why? Because he sells up everything. He sells up everything. I said, what do you do this for? the public holiday, so people buy this. You know what I mean? But you have this industrial size steamer. I said, no, because it's all finished. So what is the point of this story? He has customers, right? He has customers, so everything sells out. Okay, new idea, right? Okay, so you spend some hours something, right? You sleep, right? Then after that you make something. You try selling something, it sells. You sell it to another person, it sells. You sell it to a third person, it sells. After some time, you start thinking, this is working. So maybe I should do this. Great. Now back to medical device. So there's actually one real story. This is a company in Hong Kong. So they make this initial diagnostic kits to detect Alzheimer's disease. Right? And they were deep in research, but they have good results. And for some reason, they have a way of spinning out the company. They got some budget to hire like one junior, but the professors, the adjunct, cannot follow this company because they have to stay in the university. Then it was smart enough, right? For some strange reason, when the kit was still in development, there were 3 parts to the kits. And when the first part came out, they started to do a little bit of marketing, and somebody actually bought the kit for research use only. Then now they have all three components there, and said, look, aggressively push this. It's really not really for the money. It's actually to see whether the product has anyone buying. Right? And if there's enough people buying, then this is probably working. Because if it's not working through this scheme, right? It's not enough request or something like that. Most likely this company will not survive for very long. It can still survive for a bit of time, but not for very long. So back to your question, right? When would you say stop, right? Actually, your team will tell you when to stop. Boss, this is not working. I need to keep my family. Right? You cannot cut my fee again. That's when you stop. Right? Of course, you try out there to find investment and all that. Right? But as a leader of the company, you're responsible for actually many people. There's a lot of responsibility on your shoulder. That's why many founders are only 1%, right? And not like a bunch of people. Because the pressure is huge. You need to feed all these people, right? And you cannot disappoint them. There's only so many ones you can hold with. Right? So they will tell you, right? That's it, right? Then it's up to you to decide, okay, I still want the company to survive. Can I do something else? Can I pivot this and do something else? Maybe that drives you to think of something else to do. Right? Maybe, right? And then after that you get some money, then the money goes back into this original thing, right? Maybe. Right? Or maybe it's like, okay, let's all split and let's make some money come back again. 9 times out of 10, right, you never come back. So close. Okay? So my short answer is your staff will tell you when to stop.
Thank you for the good response there. So for the last commentator, we welcome on Super Sick, who is exceptionally good at finding money and can probably give some comments and questions to Mr. Liew. Take up.
Thank you very much for inviting me to sit in this panel. Liew has presented to us a number of important things that I believe it is a very good foundation for all of us to learn here today. That all the things from the regulatory framework, the way to think, the way we should be looking at the market, the way we should do research before we start doing our own stuff, are very, very valuable information. I think how I see things in Thailand, because I just want to compare Singapore and Thailand. Singapore has looked at this issue, I'm sure, for more than 20 years. In the past, I'm from the financial services industry. I ran one of the global investment bank in Thailand. And I just happened to learn a lot about what's going on in Singapore, K1 Venture. you had a very large venture capital established by the government, and they look at, medical innovation for a long time, invest billions of dollars into this. That's the reason why they have a framework like Liew has presented to us, a very good format, a very good thought process and vision, starting from the government. But the key thing is that when you're talking about healthcare, it's a very broad topic. In this particular case, Dr. Chatri and his team probably have to think about which area that you would want to innovate. When we talk about innovation, it's not just product development. It could be process innovation. It could be other thing that is relevant to what is needed in Thailand. For example, how are we going to improve the outcome? How are we going to lower the cost? And COVID as a case in point, that all the supply chain in the world are being disrupted. And based on your presentation, I'm quite happy to hear that 80% of the countries around the world reporting at around 90% of medical devices, and probably Thailand is around 95%. I think there are room for all of us in healthcare industry to play in terms of being dependent on ourselves, being less dependent on the import product. These probably are the areas. And if we are taking a view of the aging population into our consideration, you could see that those are the areas that we could work on. And then knowing that going forward, healthcare is going to be, like a lot of people like to say, a data-driven environment is also is an important element that medical school should start looking at things. And I think to do it successfully, it's not just the medical student. Probably you have to collaborate with the engineering school, the science school, and also the business school and the law school as well. Talking about business model, intellectual property protection, and you should start talking to the capital market and financial institutions in Thailand, because healthcare soon is going to be everybody's business. It's going to be a problem of everybody. How can we lower the healthcare cost of the country, at the same time maintain the very good value to patient? These are the challenge that requires a lot of innovation, both process and product. I also commented a lot in the past that a number of healthcare innovation in Thailand that we are trying to do. It's a global business. You cannot just look at this thing just from the startup perspective. You need to get the capital market, the financial market involved in the process from the start. I think they're happy to talk to you guys in detail, because I think one of the case I'd like to show to you that we're talking about the immunology drug for cancer. It is interesting that I think last year one of the preclinical company in China doing only 70 clinical trials has managed to get listed in the Hong Kong Stock Exchange, raising a very large amount of money, having a market cap of $1 billion US. what I'm trying to say that, well, I think now the capital market start to understand the complexity of the immunologic drug, the cancer drug of the future. I think these are the things that will the medical professional would need to bear in mind, that we're working with the financial and capital market to accelerate the product development. That's probably my idea.
So just following up on this comment, can you share a little bit about how you might suggest or approach somebody looking for VC funding or external funding, even as a perspective of us who may not have so much experience?
I have a question. Do you think Thailand and Singapore could collaborate more in this? Because we have the population and you have the organizational expertise in terms of organizing things. I think it would be wonderful if two countries start this type of dialogue, helping each other, looking at what kind of product and process innovation that can be developed, and see that, well, how can we commercialize into a larger market of, let's say, ASEAN, because all of them would need the better medical solution anyway. Don't you think?
Yes, that's certainly. The thing here is to understand about investors that are found in the various countries. We put Singapore aside for now. One of the best places to get investment money is the US. There's a reason for this, right? Because over there the ecosystem is really mature. There are many experienced people both in commercial, in engineering, in clinical, that's easily could form into a team, right? And they found maybe an opportunity to solve their unmet need. Then they just talk to a partner in the VC or maybe some Asian investors, and next thing you know, you got 250,000 US, just like that. You know why? It's not because your pitching skills are good. It's because those partners, right, they can spot a good device right away. Because they seem like thousands and thousands. So that's the most mature investment market as far as the healthcare is concerned. If you come to Asia, right, then you understand that regardless of how investors are positioning themselves, Asians are Asians, risk takers. Right? So one thing that over time Asians have gotten better is marketing. So Singapore's are champions at marketing, right? But they're still Asians. So at the end of the day, right, we may find that we're trying to get money from each other. So we've got to take care about that point. The collaboration is certainly good in the sense that a lot of money is indeed flowing into Singapore for reasons that I shall not elaborate. In any case, right, this ability to tap onto the population size and the time market is indeed something very attractive to Singapore VC firms as well. Right? So one thing about investors is not just about the money, it's about the investors' network. And why would the investor want to share that network? Because they are investing in you, not the product. You. They believe in you. This is the reason why they are investing in you and sharing a network. Like, for example, we have this discussion. You talk to me and talk to me. Next thing I know, oh, I need this. If I trust that your idea is good, then I will maybe, okay, hang on. Let me go to my line and I tell you this. Right? In a very cohesive way. So investors won't always just about money. Of course, right? In all VCs, private equity or that, they actually have people who fund. Actual people who put money in, high net worth people, family office, corporations, for that, and individuals, for that, right? So they are looking for return. So imagine yourself right now, maybe the middle mark, and you work so hard to save that middle mark. You go to a bank or go to an investment firm and say, okay, I want this middle mark to make me 10% in 6 months. Would they ever ask you to put money into medical device? No, because the medical device cannot give you return in 6 months. Right? So for VCs and for PEs, they have a very, very challenging job to go convince people to invest in the healthcare. That's why I mentioned this industry is very special. Because people who invest in healthcare know that it takes a long time, knows that it takes a lot of effort, knows that it takes some money. So anybody that is putting money into this healthcare mandate, right, is in for the long haul. Right? So they are, unfortunately, in the industry today, there are more and more healthcare specific funds that are being created, funds or sub-funds that are being created. So as a result, right, they only want to invest into healthcare, right? And they not necessarily only invest into low-risk device. It could be immunology, it could be high-risk devices and all that. So there's hope for this. What I would like to make everyone understand is that if you have an idea, don't ever shoot the idea down yourself. Talk to somebody, right, to bounce the idea off to see whether it makes sense. Even if it's very high risk, it's okay. Right? But the result is to understand why it got shut down. If it got shut down, then because of XYZ, the thing is done. If you shoot it down yourself, then how would you run? Right? So I agree that there's many things to do in healthcare, and it's important for everyone to understand and not be afraid to try.
I think they have come a long way because I think the most difficult part has already been done, which is the human capital. We've already created, we've already built a large pool of experts in various fields in Thailand. The key thing from here, from now on, is that you've already got the seed, but how are you gonna get the right soil, the right fertilizer for these seeds to grow? I think I've seen Thailand in a number of complex industries that we have tried. For example, the oil and gas, the petrochemical industry. 30 years ago, when there was nothing in the finance market, and we built the capital market alongside these development in the petrochemical and refinery areas that use a lot of money, and we had a hell of an industry. I think medical industry is about to come to play because it is required to do that, because in the old days, petrochemical complex in Thailand was successful because at that time, 30, 40 years ago, we need to import a lot of plastics, and then we need to substitute it with the homegrown industry. And we've managed to discover the gas in the Gulf of Thailand, and we turned that gas into plastic pellets, and then very large petrochemical company has been formed. And then as a result of that, we had also a very large automotive industry. And this time around, I think the medical industry needs to be transformed as well, because we need to lower the cost of healthcare for the country. We need to treat the growing numbers of the elderly people. We can project it. They're probably going to live up to 75 to 80 years, and those are the challenge that Thai government would need to bear in mind. And capital we have, human capital already built, but the key thing is the regulatory environment, the ecosystem, are the key thing that would need to be established, need to be connected in the right way. I think this is a very good starting point.
I'd like to share something with everyone. It's a story I wrote. So, okay, as you may have guessed, I think was people. I'm very fortunate at my age, I still train with the people that are 30 plus and still not get hurt. Right? So, thank God for good genetics. So, I wrote this story. Short, process to expertise. So, I'm going to read it for everybody. So, once there was a young man whose dream was to hit the foot court shot in basketball. This meant he wanted to shoot a basket across the entire 94 feet of the court, which is a great distance. But he's a great basketball fan, and I see the halftime entertainment during televised games, right? The first money up to 100,000, he was given out to also who do amazing things on the court, right? So this young man, school this. But for this young man focused on his dream, started practicing. So at first, right, he throws it and he fails to count on the fall too short. But the harder he worked, the better he got until he could launch the ball ultimately across the court. So it's still not quickly. When close to the backboard. If you try it, right, it's not easy. Yeah? So is that not challenging enough? Right? This young man worked long hours in the day and could only get to the court on the last hour before he closed for the day. So that didn't give him much time to train. He didn't give up. Gradually, his attempts started to hit the backboard. Right? And as he got better, right, it started to bounce off the grip. Right? And one day he happened to switch, he went in. So he was really happy. Oh, yeah, I got it in, right? I got it in the full court shot. So perhaps, just perhaps, I may be able to go on the television and bring the 100,000 times money if I'm able to sing the full court shot all the time. So he becomes very, very excited and with a lot of energy. He tried again, all the time he missed, no problem. He tried again, he missed again, no problem. Right? He tried and tried until the court was closed for the day, and when he went home, it was a big one. The next day, right, he returned and began trying. Right, he did not hit a shot this time, but the ball was bouncing off the backboard and striking to much more frequently. But that means he's getting a little bit more accurate. But still, it was still inconsistent. Just as he was feeling expected the physical get. And strangely, with each passing day, after the euphoria of the past 2 days, the government started to fire back no service, going nowhere. Sometimes it's like you just lose track, like, oh, am I really going to make it, right? So he starts to wonder why it happened. And the expectations of him hitting the one shot created pressure, he had affected his concentration, his focus. So he couldn't shoot again. Then as if was stopped by lightning, suddenly this young man had a thought. Perhaps he should ask for help. And share the prize money if anyone was helping. So the gym instructor came to give advice. The reasons why your shot is not accurate is because your muscles are strong enough to put the ball into you so that you're strong enough and share the prize money. That's my cursor. Okay. So, at the experience of no age I to make half court shots. About I will never hit the full court shot in my life. I can see I can help you improve your shot release. So if I help you do that, then can I share the price? Then a sports agent turned up. So he worked in the industry and says, what's the use of practicing so much if we can't even get into a show? So I can help you with the application form and finding all these venues and where the prize money is available. So can I pay the price? And finally, the owner of the basketball court, right, seeing this young man so enthusiastic, I can keep the court open for you for 2 hours a day, so you get the chance to practice properly. But then, can I share the rest? So the government had accepted all these offers, okay, and they form a team. So the coaching for the muscular veteran, strength training for the gym instructor, and you practice longer hours on the court at night because it's open longer for him. Now you can regularly hit the backward. And suddenly all the shots start to go in. Right now we're onto something, so everyone's excited. So the young man kept training. Right? The sports agent was busy applying to get the young man into all these half-time shows. Any applications were rejected, and the man was discounted. But the agent kept carrying on, right? Because a month after they formed the team, and finally he gets a show that accepted him, right? For the day of online. And in the work of many people, putting time and effort and hopes of the fruitful career. The entire team came together to get the young man ready. The veteran took advice on how to move, right? Gym jumped in, helping warm up. The court's owner lent him a pair of good shoes, and the agent guided the man through the stadium, all the way until he decided the course. Under all these bright lights. Right? So the MC said he had 3 chances. So the young man was very nervous when he fired his first shot and missed. He looked around the stadium, and the second shot, he saw his friend standing and shouting. So he tried again, but he hit the ring, but it didn't go in, right? So then he hears his friend say, "It's okay, right? Even if you miss, we can try again." So the young man was feeling confident now, and he felt there's nothing to lose. Why? Because there's no more expectation. But you can always try again in another show. Then took the last shot and went through. So the audience came to their feet, and everybody in the roar of approval, and friends rushed to him, cheering joyful, and they've done it. So what has this story got to do with medical device? You see, because the medical device startup, there are many processes involved, so there's a lot of work to do, and it's eventually. So you reach before you can actually launch and get revenue. So just like the young man, sure, it's not impossible to try to do this alone, but the market is competitive and the time is limited. If you don't have the right experience in the life, you may find yourself progressing very slowly or not at all. When you have the right expertise, your chances increase exponentially. With help of experts who have been in the industry for years, like I mentioned, your business modeling and your investment, for your business modeling and your investment pitch. You may get support from people who can navigate some minor details that you never think about, like a gym instructor or strength, especially in product development and manufacturing. You need connections and infrastructure to facilitate some processes like the owner of the court will stay keeping open for 2 extra hours. And finally, you want someone to guide you to the right place at the right time, which is the sports data to market your product. What we missed describing was how the money was split between them. Actually, I don't know, right? But anyway, for anybody, this is critical. You must know how much you're giving away, right? So you will move through all these different phases of training, getting funding, business, consulting, quality system, workshops, and you're inviting people to see these opportunities to see your full control. Yeah, so I hope this story will be.
Okay.
Thank you. I think the other thing you want to mention is that most of all just trying to remember your joys. So I think having come from a long way, and I think everybody coming from a long way. Maybe I don't know whether I don't know if the time is out. Do you want to ask some questions? Yes, I think that's good.
So my name is Liew Shibor, and I'm the first year medical student from Faculty of Medicine, one of the I believe that one of the most important things for accounting, especially as our is related today, can learn from the use. And especially that when in the case that you're building something that doesn't even exist, you have so many things to validate the assumptions, like whether the problem actually exists, or whether your solution could actually solve the problem. So I have a question. Would you mind sharing us some advice about how a MedTech startup can get the first users, like based on the first doctors, the first patients, or the first hospitals that we can start the learning process with?
It's usually by accident. unfortunately. So, for example, let's say, right? So you should try to go to lunch and see the people start talking about the day starts because they're going to do so many people. I go to the dialysis center and all my nurses are all not looking at the patient and they're all filling out forms. And it's not working, right? I cannot hire more staff now. Then you start thinking, okay, why are you filling out all these forms? Oh, because there's no way to stream the data directly from the dialysis machines. So we have to manually enter them. Okay? Is there some way that we can do that? Or we can't? The manufacturer is not letting me tap data out. They all block it. Okay, there's some other way. Anyway, there's actually this company that did it. So they actually did an OCR solution, so you take a photograph, and next thing you know, it turns into digital and everything is captured within one platform. It's by accident. I'm not saying that you get accidents all the time. I'm just saying that it comes with talking, and the fundamental is that it must come from the need. It must come from the need. If there's no need, there's no need.
I see. Thank you. And I have one last question. I believe that the best way that a company can learn from their users is to ship the basic prototype of the product, or something that we call the MVP, the minimum viable product. However, for a MedTech startup, the challenge is that there are so many regulations and so many quality controls that we have to take into consideration, and that drives up the cost for each cycle of product operation. I believe that it is the greatest challenge for a startup that is based on basic. So my question is that, would you mind sharing some advice about how a MedTech startup can create and iterate the prototype of their product, while also ensuring manage their cost so that they can enter the broad market as a launch?
There are two things to think about. One thing is what we talked about in regards to funding, which you cannot solve this, right? But there's one part that you can solve, and that is actually to look back into history to see how medical devices were first created. Do you think in the past there were so many diseases? Do you think in the past there were so many grants? No, right? It's basically doctors extra time, like who's spending this extra time to go and do extra work to create something, right? And in some cases, like in the past, those doctors had no money, so they had to find help or they do it themselves, right? So just like my friend who builds body therapy, in some cases, like you just have to find a way to do something yourself and try to do something yourself, and it does involve your own investment. Right? So you cannot depend on the country to support you, or the universities to support you all the time. Right? So you try to make something on your own. So whenever you feel that you don't have enough, right, you always think about the people before you who have even less, and when they still made it. Of course, the environment is different. Costs have gone up. Things have become complex. True, you have become smarter too. Right? So life is fair in that sense.
Thank you for your insight. That's all.
Well, I'm Rebecca from Faculty of Medical Technology with Med. I've got two questions. The first one is a detailed question, and the other one is the strategy question. The detailed question I'd like to ask about the regulation ISO 14156, the clinical investigation. Can it be done simultaneously with like the usability design or clinical trial?
Yes.
Okay, so we cannot. Okay, we can do it simultaneously for. Okay,
Sure.
great. The other one is that, well, we have mentioned a little bit about the senior home, and I was thinking about the trend nowadays that the wellness center, wellness clinic, wellness hospitals are growing. So, well, is it possible in terms? I mean, like, if you have a device that is not yet classified or defined as a medical device, and then can be used at this kind of facility and then make some money from this,
Okay.
and then later, shift to the medical device with like, with the right definition.
Okay.
Yeah.
Let me show you this company, okay? You know this company fit this profile.
Thank you.
Wait, hang on, let me do the sharing again. Share, right? Okay. So, this originally, right, was a device. What originally was a device that is meant for medical purposes. Why? Because I know the matter since early days. Right? Then, when they finally spun out the company, their investor says, no, I don't want to do medical device because it's too hard. Can you just sell it to wellness centers, right? Set up your own clinic or send somewhere. For that matter, I use the device. Why? Because I told my ministers during basketball, right? And I was very frustrated because I was not recovering quickly enough. So I know the CEO, I know the founder, I know the president, I know everybody there that I spoke to first. I didn't know that. And they charged me a very low fee, but I still had to pay, and I went through and passed. So initially, all this device was meant for old people who could not walk very well, could not stand even, and all that. Next thing you know, you get all the sports people turning up. Why? Because they are impatient. I was super impatient because I have only 10 more years before I cannot really play basketball anymore. So I cannot afford to have injuries. So I became impatient. Then when I'm impatient, I know that I shouldn't go out and play. So I need to find another way. So many sportsmen became impatient and started using this. So this thing, right, in a different way, could deal with medical conditions. Right? I can't say what they are. Right? I know all of them, but I can't say what they are. But they can do many things because they activate this thing called myokines in your body to accelerate the healing process. And if you think about it, you could actually do many things. If you start looking at it, you will know what else you can do. So this is one of those cases where even though they were forced to do something they didn't like, for some reason it worked, and now they got revenue to start to pay for their own clinical trial and work. This is just my show. I didn't give them a chance. Anyway, they did well, and I'm the user too. Okay.
Any more questions? Yes. Yeah.
So in continuation to my colleague's question, from that question, so yeah, in order to get a product in the initial momentum or maybe initial launch, is it better to launch our product into say a well-established market where there are more alternatives or competitors, or is it better to launch our product into pioneering new markets where there have not been a lot of doctors or a lot of advanced medical technology in order to get the product in momentum first?
Yeah. So just now I answered Soyun's question, right? And the stance I was talking about. Right. So in that particular situation, because it's fairly common, even though the indication is not so common, the advice given is to try a different market. But in some cases, because you need to be known, right? Then one thing you have to be very careful about is, there comes another one of these. If people start saying this, then they're process. Right? So there could be also markets that are very developed and there's a lot, but they're so large, right, that not everyone can get to it, or they are willing to look at alternatives if they're cheaper. Maybe. Right? Because if we always start to go after markets that are not known, right, you spend extra time. You may not have the extra time. Right? But one thing is for sure, right? You cannot just stay on China. You have to find a way to get out. Even our company, right? The first business we ever got was never from Singapore. Right? We around 30% of business in Singapore, that 70% is actually from all other countries. So we never really consider ourselves in Singapore. And so you will be very careful about it. It really depends on the product.
Any more questions? So, I think I'd like to say I'm very happy today. Not just happy because of Dr. Liew coming to give this wonderful talk here and having our great guests, but also speakers, but also happy because of the students attending our events and all the other staff, facilities after hours and so on. So I think that what I would like to say is, as a director of Mind Center, is that I think we would like input from the students a lot as to what types of activities and what kinds of things you would like to do for the future. And I think somebody asked, who should we go to if we have an idea and so on. I think one of the people that obviously it's your mentors and so on, I think at some point, but if you want other connections, the Mind Center is, it's our role to try and help you with this kind of connection. But so therefore, I think that please write your name, email, and contact address so that we can share with you what activities and we have, and we can share the files that that we have from today's meeting. And also, so that's what we would like the students to be able to do to help us in the future design what kind of events we have. So, so before concluding, I'd like to thank the staff of the Mind Center for staying behind and organizing all this, and especially Kun Bin, the head of the Mind Center, the manager. So if you have any, please, Kun Bin, put your hand up. So please, if you have any issues, please, questions and so on, and any ideas you want to about the Mind Center, please talk to Kun Bin or call or email. Okay, so, so with that, some more housekeeping things. Please, there's a for so yeah, so please complete the satisfaction survey as well. And there's also some dinner on the way out, so you can take some a snack or something on the way out as well. And so finally, I'd like to thank all the commentators, Dr. Liew, Dr. Thitiwat, Kun Phakawat, and also the set for their time commenting, and also, and finally for Liew for coming here all the way from Singapore. It's a great session. Thank you very much.